Hi, 5-minute anatomy, anatomical position, and the first few movement names. So the starting place when using movement names for Western anatomical lingo is this. This is called anatomical position. The palms are turned forward, standing up straight, shoulders down and back, facing straight ahead. Anatomical position. This is the starting place in reference to all the names of the different movements. And the movements themselves are often named after the planes that we're moving on. We'll be gliding along different planes, like a plane parallel to the wall, a plane parallel to the floor, and the movements along those planes have specific names. So starting in anatomical position, since I am up against the wall, if I move my arms out to the side along this wall, this is called abduction and adduction. Abduction, moving away from the midline, adduction, moving towards the midline. I can do it with my hips, abduction and adduction. I can do it both legs at the same time. We often do that in yoga, bilateral, both-sided, abduction, adduction. I can even do it down at these joints, the joints between the metacarpals and the phalanges, where I would do abduction and adduction, or in anatomical position, abduction and adduction. Moving away from the center line is abduction. Moving towards the center line is adduction, adduction, abduction, adduction. Now, if I move my spine along this same plane, I get this. And this is called lateral flexion or side bending. Lateral flexion to my right, lateral flexion to my left. I can't abduct and adduct my spine because it is the center line. I can't move the center line away from my center line. But I can laterally flex the head, laterally flex through the cervical spine, okay? Abduction, adduction, lateral flexion. If I change the plane of movement, I'm just going to turn my body. So now the plane is going front to back. Now, if I move my shoulders again along that plane, this movement is called flexion, and this movement is called extension. Flexion and extension, moving along this sagittal plane, this front to back plane, like a wall alongside me. I can also flex at the elbow and extend at the elbow. I can flex at the wrists and extend at the wrists. I can flex through the fingers and extend in the fingers. I can also flex at the hip and extend at the hip. I can flex at the knee and extend at the knee. I can flex both knees. When I flex both knees, I'm also flexing my hips and extend both knees and hips. And then at the ankle, it has a special name. It's still a type of flexion and extension, but this one is called plantarflexion. This one is called dorsiflexion. Plantarflexion, like you're planting a seed in the ground with your big toe. Dorsiflexion, lifting up towards the dorsum or the back of the foot. I can also flex my spine. I can individually roll through and around my back, flexing the spine, and I can extend the spine, coming back to neutral, and I can keep extending past neutral, and then flex back to anatomical position. We got time for one more. I'm going to do the plane that's parallel to the floor. If I move along that plane at my hip joints, I'm rotating, externally rotating the hips, internally rotating the hips. If I rotate at the shoulders, I'm going to bend my elbows so you can see it a little more clearly. I can externally rotate at the shoulders, internally rotate at the shoulders. I can also do rotation along my spine, but it's not external and internal, again, because it's the midline. I'm rotating my cervical spine, my neck, and rotating it back to center, and then rotating it to the other side and back to center. I can rotate the spine back to center and rotate the spine and back to center. When learning anatomical planes for the movements, it's tempting to really simplify it, to think that we do all of these movements along these planes, but we are not like that. Our movement is much more complicated than that. But this is like learning the alphabet of the movement lingo. So if I bilaterally, both sides, abduct my hips and externally rotate my right hip, and then flex my right knee, and then bilaterally abduct my shoulders, and we didn't get this movement yet, but it's a form of rotation, and then I rotate my head, I've got warrior two. Would you ever use that lingo in a class? Only if you're teaching a room full of physical therapists and they would love it, but usually not. This is a communication tool for when you're talking with doctors or physical therapists to be really clear about lumbar extension of the spine, as opposed to saying back bending. We want to be really clear when we're working with folks with injuries. I think that's about 6 minutes. Thanks.